It is parents' top priority that their children are properly nourished so that they can grow and develop healthily. Among a variety of key supplements in the child's diet, one stands out of them all as the top topic of discussion: iron. This video presents how to ensure your child to have sufficient iron intake and why it matters. In general, iron is a driving force for juniors' healthy development. It makes for a fundamental building block of hemoglobin, which in turn is the building block of humans' red blood cells, the oxygen transporters in our body. To explain, iron is the reason why our cells are kept alive and maintain optimal performance, the fuel provider of the brain and nerves, the body's command center. Without sufficient iron, a disease called iron-deficient anemia may arise when there are not enough functional red blood cells in the blood. With that said, there can't be enough red blood cell without enough iron. To identify, a person identified with iron deficiency anemia displays symptoms of pale skins, coldness, hasty breathing, feeling de-energized, inability to stay focused, short temper. What the parent should know about iron. Iron is of particular importance to the newly born since they reach 6 months of age and start weaning. Having used up the lingering iron they received from mothers during pregnancy, babies at this stage require food with a healthy amount of iron to ensure their development. Major causes of iron undernourishment among juniors. Among the many causes of this condition, the top meal-associated ones we should beware are: failure to deliver weaning meals with sufficient iron, lack of red and white meat intake, overeating milk-related food, imbalanced food intake over a long period, or engagement in intense physical activities during teenage years, in particular, female athletes. What to do if your child does not have enough iron? 1. Make sure your child takes in enough iron from daily meals. Our meal-derived iron comes from two main sources: animals, aka heme iron, such as red and white meats. This type is easily digested by our bodies. The second type, non-heme iron, is from plant-based meals like beans, peas, tofu, to name a few. As our body cannot take in non-heme iron as easily as heme iron, people following vegan diets are required to absorb twice as much as iron compared to those with a normal diet. To heighten the ability to take in non-heme iron, these are some good suggestions. Cook meals that have both plant and animal components, such as kidney beans with ground meat. Integrate food with abundant vitamin C into your child's diet. This will give the body a boost in absorbing non-heme iron. Options include citrus fruits, mango, berries, broccoli, tomatoes, peppers. Some top animal and plant iron sources to consider are lean beef, lean pork, poultry, dark meat, scallops, shrimp, salmon, tuna, eggs, prunes and prune juice, raisins, peanut butter, beans, or tofu. Children from 6 months and 1 year old should have a high iron meal twice a day, 1 or 2 small bowlfuls. Chewable meat or well chopped up meat, fish with bones removed, kidney beans and high iron cereals are the go-to foods for kids. 2. Try a cast iron skillet. A surprising way to enrich the iron content in your next fried meal. A skillet made of this material can contribute some of its iron component to making your meal iron-rich during the cooking time. Food with acidic nature such as tomatoes can benefit the most from this property. Cast iron skillets also make for great heat conductors, meaning you can cook your food faster, preserve the heat longer, much longer. Another benefit to cast iron material is that it contains no chemical danger like non-stick pans, of which surface material can be accidentally absorbed by your food during cooking. 3. Don't overdo on milk-related food. Although they contain a generous amount of key substances for healthy development, excessive consumption of dairy products like milk, cheese, and yogurt is actually a bad thing. As the kids may well overconsume these nutrient-rich foods, their bellies may be filled up before other nutrients from other food sources to fill in the place. As dairies contain no iron, this can lead to nutrient imbalance and thus iron deficiency. Thus, it is important to remember to serve milk in parallel with other foods and keep your child's dairy intake under a safe threshold. Maximum amount is 500 ml a day. If the child's dairy consumption is exceeding 750 ml, 3 cups of milk daily, not to mention other milk-related foods, they run the risk of failing to take in high iron meals later. What to do if your child is a picky eater? Introduce yourself to the concept of division of responsibility. You, as the father and mother of the kid, are to take charge of the food your child eats, as well as the time and place he or she eats it. However, your child also has his fair share of responsibility. Whether he will eat the food and how much is up to him. If he is provided with a plethora of iron-abundant meals daily, without pressure, and shows signs of being picky, he may well be subject to iron deficiency, and the more prolonged the behavior, the more worrying it is. However, it is beyond your ability to handle that alone, and it is now that you should seek advice from a qualified expert for effective solutions to this problem. Have your child's health checked now and then. Even with a well-balanced diet, you cannot be too careful for your child. If you want to know how to take better care of your baby, seek guidance from a certified doctor and give your child a proper health check. An iron supplement may be beneficial for the undernourished, however, only give your child that substance boost when you have heard the word from someone with the expertise. Too little iron is not good, but too much of it is not, either. All in all, it is important to keep a healthy balance in your children's nutrient intake. Parents should be well informed on what substance their kids need and how to provide them properly. Which nutrients do you think your child should have? Tell us in the comments section below. Thanks for watching. If you find this information useful, please give us a thumbs up and share it with your friends.